Hi, May is Skin Cancer Awareness Month, and it's a good opportunity to talk about skin cancer with your family members and to talk about prevention, about detection and diagnosis, and then about treatment. We divide skin cancers into three main types. We have melanoma skin cancers and non-melanoma, and the non-melanoma ones tend to be basal cell cancer and squamous cell cancer, and these three make up about 95% of all skin cancers. Let's talk about melanoma today, and we can go through the others tomorrow. The importance with melanoma is looking at who's at risk. And with fair skin, with fair hair and fair eyes, we are more at risk than people with darker skin. Childhood sunburn is important. The amount of sun exposure you get is really important because the vast majority of skin cancers are caused by ultraviolet damage. Ultraviolet A rays are the ones that get through cloud and water and through glass, and they're mainly responsible for skin aging and pigment and wrinkles. It's ultraviolet B rays that tend to cause most of the burning and skin cancers. Sunbed exposure is particularly harmful as a risk for skin cancer, especially in younger skins like teenager skin, much more vulnerable to it. You want to look at any family history of skin cancer and those fair-skinned, fair-eyed individuals, and your sun exposure is critical. The detection is important, so look for any changes in skin spots or pigments or anything that's changing that you're not sure about. Get somebody to check it out. Never ever let a non-medical person burn off or snip off any innocent tags or other skin conditions without getting a formal diagnosis first. If we look at melanoma then, this is increasing in incidence. It's the fourth commonest of death among under 40-year-olds in Ireland. That's really sobering. And we think of 5 things with melanoma: A, B, C, D. A is for asymmetry. Does that mole look equal? And if you draw it on a sheet of paper, and this is bigger than average, then you can fold that piece of paper and the two sides look the same. This one is symmetrical, this one is asymmetrical, and this one is asymmetrical. B is for border. Is the border smooth and round, or is it raggedy like this? So the raggedy ones are more worrying. If I look at this innocent mole on my arm, it's symmetrical and the border is nice and even. C is for colour, and so most harmless moles are pink or pale in colour and they just have one uniform colour. If you think of a malignant melanoma, it's often got a range of colours like white, red, black, brown, and it just looks different. D is for diameter, and so we think of the end of a pencil, and if a mole is bigger than that, it's something you really need to get checked. And the E is for evolving. Is it changing? A mole that was originally looking like this and then it starts to get bigger, it bleeds, it itches, the colour is changing, that's one to get checked straight away. And the other sign we look out for is called ugly duckling. If you have 10 moles and they all look the same, and then you've one that just doesn't look the same, that's a sign you need to get that checked out. How can you diagnose these? You really need to see a doctor for any changing skin problems, and that's so important. In terms of treatment then, there are a whole range of treatments for melanoma, but the key is really prevention. Wear your broad spectrum SPF, particularly those intense sun exposures on holidays. Seek shade at hot times of the day, put on protective clothing, wear a hat, wear sunglasses, and absolutely try your best to avoid sunburn, and at all costs avoid sunbeds. Feel free to get in touch with any more questions and I'll do some further posts tomorrow. Take care, bye.